Smiles all around for Kelly Walker, her husband Josie, and her physicians at Batson Children's Hospital.
You look great.
Thank you.
Just 4 days earlier, this 28-year-old from the Washington, D.C. area had open heart surgery to replace a pulmonary valve she received 14 years ago at Mississippi's only Children's Hospital.
How are you feeling today?
Really good.
Could you tell a difference as soon as you woke up?
Not as soon as I woke up, but there's definitely a difference already in my breathing. I mean, I think Dr. Salazar said that I went from breathing out of a straw to a garden hose. That's what he said. So I immediately could breathe better. So now I just got to get rid of the soreness and I'll be okay.
Well, take your time. You're actually way ahead of schedule, so don't feel like you have to push yourself.
Okay.
You know, I am happy to say that we've become a regional referral center for not only pediatric but also congenital heart disease that you're born with. And it's not always obvious to everybody that congenital heart disease is not something just found in children. Of course, children are born with heart defects and they get surgeries to help the hearts work better. But it really is a lifetime commitment to these patients. And of course, those children grow up to be adults and they still have surgical needs. And so they tend to want to go to centers where they specialize in the care of congenital heart disease, which spans the pediatric and adult populations. And now, over the last 2.5 years, we've done 750 operations with very good success. And I think she's heard about that.
I've just been coming here since birth, so I just can't go anywhere else.
It's home to you.
It is. They take good care of me.
In my opinion, she's done great. I mean, just to be up and moving 3 days after having your chest cut open is great.
It's amazing, isn't it?
It is amazing. I'm very impressed.
How's she look to you?
She looks fantastic. Coloring is good. She looks really good. Everything works out great, though. We got a wonderful hospital up here, so we're very pleased.
So will she go another 14 years or so and then have to have this done again?
Well, the good thing is that we have a very close partnership with the cardiologists. And the cardiologists are able to do a lot of procedures using catheters, not requiring surgery. So the valve that we put in here sets them up so that way their next surgery isn't actually a surgery at all. It's a heart catheterization procedure where they can implant a valve through a catheter in her leg, not open heart surgery, that will save her essentially at least one operation, maybe two, over the course of her life. So it's an exciting partnership between the two. Given that 99% of the time or more, everything does turn out well, we're really offering to these patients the opportunity to have a normal life. And as I've told her and her husband and her family, you know, the most important thing is that she enjoy her normal life.
And that's just what she's doing. Congenital heart disease hasn't limited her life, it's defined it. Now, in the nation's capital.
I took a job up there. I work with transcranial magnetic stimulation for neurological dysfunction.
Did your desire to kind of go into medicine have anything to do with...
Oh, absolutely. I could probably be a cardiologist. But now I went into mental health, and now I'm more into neurology.
So they throw around all these cardiac terms, and it's no problem for you.
I got it.
To learn more about the Congenital Heart Program at Batson Children's Hospital, go to childrenshospital.umc.edu. I'm Jim Albritton reporting.
That's not on tape.
No, sorry.